So VP-elect Mike Pence met with House and Senate Republican leadership yesterday, emerged from said meetings with the House in particular, and had this to say about the disposition of the incoming administration.
Today, our message is very simple. Working with the leadership here in the House and in the Senate, we're going to be in the promise-keeping business.
And that first promise is repealing Obamacare, which he intimated Trump is going to do on day one with a series of executive orders.
It'll literally begin on day one. Before the end of the day, we do anticipate that the president-elect will be in the Oval Office taking action to both repeal executive orders and also set into motion through executive action policies to implement promises that were made on the campaign trail. But the first order of business is to repeal and replace Obamacare. And that was our message today, and it'll be our message on Capitol Hill. And it needs to be done.
And just on the repeal part of it, particularly executive action, there are some areas where Trump could issue executive orders on day one, as Pence seemed to indicate. He could decide not to enforce the individual mandate. Mm-hmm. He could move to end the cost-sharing reductions or drop an appeal the Obama administration filed in response to a House lawsuit on the cost-sharing reductions. Cost-sharing reductions are the discounts offered to eligible consumers who purchase silver-level plans. The federal government then reimburses insurers for the reductions. He could also move to end the reinsurance payments that insurance companies receive from the reinsurance program under Obamacare. So there are things that he can do, but there still seems to be much controversy about what the replace looks like, and this is where Democrats have kind of entered the breach and come up with a new slogan.
Yeah, and Chuck Schumer said they've had 5 years to come up with a plan. There's no plan, and it's not Make America Great Again anymore. It's something else.
The Republican plan to cut health care wouldn't make America great again. It would make America sick again.
And then President Obama, did you see him scurrying about? He looked so uncomfortable there meeting with lawmakers at Capitol Hill, and he called it Trump care. That's what he was saying.
Doesn't like to come down from Mount Olympus to have to deal with these people.
Right. So they're having dueling meetings.
But Republicans do potentially have an issue. They can potentially put themselves in a bit of a pickle if they don't move with the replace and do so seamlessly, essentially the opposite of the Obamacare rollout, because as the Wall Street Journal opined yesterday, until they pass a coherent market-oriented substitute as a political matter, Obamacare is Trump care, like it or not. Well, for more on this, what the replace in particular could and should look like, we're pleased to be joined again by our friend C. Stephen Tucker, he of healthinsurancementors.com, one of the leading Obamacare and health insurance marketplace experts in the country. C. Stephen Tucker, or CS, as I like to call you. Thanks for joining us. Appreciate it.
Good morning, Dan and Amy.
Morning. So what is your disposition in terms of the disruption that would occur in the marketplace if Republicans do a repeal, delay, at some point replace?
First of all, there will be no disruption for anyone's current health insurance plans, none whatsoever. What's going to happen is in the month of January, in a few short days, when President-elect Trump becomes President Trump, he's going to get rid of the things that were done illegally by this president pertaining to Obamacare, such as you accurately mentioned, the cost-sharing reduction, which was passed without Congress, which was not in the bill, which artificially lowers premiums and deductibles for people who buy silver plans and are below 200% or 250% of the federal poverty level. So that's going to go away. The mandate to purchase health insurance is going to go away. And there are several other onerous provisions that hurt business that are going to be repealed right away. And then throughout the rest of the year, those who have health insurance subsidies will be able to keep them until the end of the year, when around September or October, we'll start seeing new products enter the marketplace that are obviously less expensive. You'll have far more options. And my hope is, if you read Dr. Price's bill, the Empowering Patients First Act, which is the bill that will be replacing Obamacare, or some version of it. I'm sure there will be changes as it goes through the Senate, but that will be the bill that replaces Obamacare. And that is one of 19 bills that have been written by Republicans since Obamacare was passed into law. So when you hear people like Chucky Schumer say that Republicans do not have an alternative, we do have a viable alternative, and it will be Tom Price's Empowering Patients First Act. So I'm very excited about the options we're going to start seeing in the fall for purchase in January of 2018. But I'm even more. Go ahead.
Explain to us on with respect to Tom Price's bill. Now, again, Dr. Tom Price, the Trump nominee for HHS secretary. Explain to us what his bill does with respect to two items that are popular, right? 26 years old, up to 26 years old, stay on your parents' health insurance, and those individuals with pre-existing conditions who otherwise struggle to get health insurance coverage.
Yes, the failure to launch clause.
Yes.
That will continue. It was actually the law in most states long before Obamacare. You could keep your child on your plan till they're age 25 in Illinois and longer in other states. Of course, there were requirements at the time, like you had to be attending college, moving forward in your life, doing positive things. Now, of course, you don't have to. You can just live in the basement and be on mom and dad's policy. Nevertheless, that's going to stay because that is popular. And then most importantly, pre-existing conditions. We are going to return to the way pre-existing conditions were covered for nearly 20 years before Obamacare. And that is people who have pre-existing conditions will be able to get coverage for those pre-existing conditions, presuming, of course, that they follow HIPAA law. HIPAA outlined in Section 2741 for decades before Obamacare how pre-existing conditions will be handled in the individual and the group marketplace, so employer-sponsored and non-employer-sponsored. In the employer-sponsored market, if you kept 18 months of prior coverage, you would have coverage for all your pre-existing conditions if you switched policies, so long as you did so within 63 days of losing one policy and moving to another. That was the law for many years in the group market. In the individual market, that will now be the law. So they're extending something I've been asking for many years, extending that provision to the individual market so that people cannot game the system. The crux of the problem with Obamacare, and the reason we've lost 19 carriers, 19 health insurance companies, 250 health plans in 36 months, and the reason we only have 3 carriers left in Illinois in the individual market, is that people were allowed to game the system by calling healthcare.gov and stating that they lost income. In HIPAA law, it outlined special enrollment periods, qualifying life events where one could jump onto a health plan. You cannot jump onto your employer's health plan unless it's open enrollment, unless, of course, you have a child, you get married, you get divorced. There were very strict provisions as to when you could come onto an employer's plan. Other than that, you join the first of the year or whenever the open enrollment period is. And that's the way it was supposed to be in the individual market. Unfortunately, under Obamacare, they added a new special enrollment period called loss of income. So people would simply call healthcare.gov and talk to the unlicensed, inexperienced navigators and state that, yeah, I had a loss of income last month. I need a policy. And so they would jet issue the policy and tell them within 90 days, we want you to send proof of said loss of income to our address in Kentucky. So people would simply get the policy, and then they would go to the hospital and get the surgery that's pending. It took the insurance companies, after losing $1 billion in 1 year for United Healthcare, $760 million in 2 years for Aetna, and $750 million for Humana, to figure out that something is wrong here. And after they crunched the numbers, the actuaries realized that there was a strange correlation between the time period when one has a, quote, loss of income and when one has a scheduled surgery.
Yeah.
They seem to be very close together in dates and times.
People
Then they found out
people respond to incentives. What a revelation.
So, Stephen,
it's just human nature. And then they found out that those people dumped those policies on an average of 32 days later. So they were gaming the system.
Yep, they sure
Mr.
were.
Price's bill will not allow that.
So, Stephen Tucker, we need competition in the market, obviously, to lower costs. And you're saying that that's not going to happen until next September, October?
Yeah, it's going to take some time to get Mr. Price's bill through the Senate because we, of course, do not have, a 60-seat majority. We do have a simple majority, which, of course, we can use reconciliation to repeal the entire law. And thanks to Harry Reid, there's no more filibusters. So it's very easy to repeal the entire law. The question is, as we are negotiating in the Senate, what part of Mr. Price's bill is going to be kept and which part is going to be changed, et cetera. So we don't know exactly how it looks, but we do have a very good template as to how it's going to look going forward.
And some of those additional key provisions on Price's bill, so it's not just going back to the way things were before Obamacare, but some of the ideas that have been promulgated by Republicans for years, even before the presidency of Barack Obama. Things like being able to sell health insurance plans across state lines and other market-oriented reforms that do a better job of increasing competition and connecting consumer to provider.
Yes, and we're going to see a lot of competition because the insurance companies are going to be able to offer plans that do not include things that are not medically necessary, such as maternity, sexual reassignment surgery, which we are all paying for now, hair plugs, etc. There are mandates that are ridiculous that have been forced by special interest groups onto health insurance plans that none of us want to pay for, or a very small percentage of society wants to pay for, and yet we are now all forced to pay for them. So I think those things are going to incentivize insurance companies to come back into the industry and offer health insurance plans that are more affordable. We also want to be able to have our health savings accounts restored. We want to be able to pick our deductibles instead of being required to have a deductible as high as $7,000 and $7,000 only. There are new options that are going to be coming into the marketplace, and I could not be more excited. I'm even more excited about Seema Verma. Very few people are talking about Seema Verma. She is the brilliant woman who designed Healthy Indiana for Mitch Daniels. Thanks to President Trump's appointment of her to the Centers for Medicare and Medicaid Services, replacing Cruella Sebelius and her lackey Sylvia Burwell, we now have a woman who actually has a proven track record of saving the state of Indiana hundreds of millions of dollars, but also providing incentives for those on Medicaid to actually act as if though they have some skin in the game when it comes to purchasing health insurance, providing an impetus for them to save their own money for the future in what's called Power Health Savings Accounts. So she has a proven track record. Couple her with Tom Price, and we have a very good future as pertaining to health insurance in this country for the first time in 8 years. He
is C.S. Tucker, C. Stephen Tucker. He is the founder of HealthInsuranceMentors.com, Obamacare and health insurance market expert. C.S., thanks so much for joining us. As always, appreciate it.
Thank you.
And he joined us on our turnkey.pro answer line.